Bipolar disorder is a mental health condition characterized by mood fluctuations and energy levels. Bipolar disorder affects each person differently. The length of manic, hypomanic or depressive episodes will determine the type of bipolar a person is diagnosed with. Hey PsychTubers, welcome back to the Max Mental Health channel. In this video I am gonna be talking about difference between bipolar 1 and bipolar 2 disorder. Periods of elevated mood and symptoms of depression occur in both bipolar 1 and bipolar 2 conditions. If you have bipolar disorder, your feelings can reach abnormally high or low levels. Sometimes you may feel overly excited while other times you may find yourself sinking in deep depression. This can last for 2 weeks, a month or more. All types of bipolar disorder are characterized by episodes of extreme mood. The main difference between bipolar 1 and bipolar 2 is the degree to which mania presents. Bipolar 1 disorder. Here is where a person experiences full manic episodes. This causes a change in mood and energy. The symptoms are severe enough that they may interfere with a person's mood, work or school. While bipolar 2 disorder involves a major depressive episode lasting at least 2 weeks and one hypomanic episode. Less severe symptoms occur during a hypomanic episode, while in hypomania a person can experience an elevated mood which isn't as intense and doesn't last as long as the manic episode. There are different ways in which one may experience the two types of bipolar disorder. Those with bipolar 1 disorder experience more severe mania, whereas people with bipolar 2 disorder may have less intense manic symptoms and more depressive symptoms. Bipolar disorder exists on a spectrum, so it's possible your symptoms don't fit with either type 1 or 2. A manic episode lasts for at least 1 week and its effects are intense and debilitating, affecting someone's work and personal life. Symptoms include talking too rapidly and loudly, which is an erratic behavior, breaking the law and spending recklessly. A manic episode may also cause someone to have overblown feelings of self-importance. There must be at least one episode of mania for a diagnosis of bipolar 1. Those with bipolar 2 disorder experience less intense symptoms in a hypomanic episode. They usually feel euphoric and excited for a few days. They are extremely active, appear agitated and have difficulty sleeping. It is possible for someone to be diagnosed as having bipolar 2, and then to have an episode of mania that changes their diagnosis to bipolar 1, as not everyone who has hypomanic episodes has bipolar disorder. A hypomanic episode is a period that's less severe than a full-blown manic episode. A person with bipolar 2 disorder doesn't experience manic episodes intense enough to require hospitalization. If depressive symptoms are the major symptoms at the time a person seeks medical attention, bipolar 2 is sometimes diagnosed as depression. Depressive symptoms become the focus when there are no manic episodes to suggest bipolar disorder. Another difference between bipolar 1 and bipolar 2 disorder is prevalence. A bipolar 2 diagnosis requires a patient to experience one or more depressive episodes. Those with bipolar 1 disorder may experience a major depressive episode. It may not be a required diagnosis. During the manic episode, the person can experience the following symptoms for at least a week: irritability, excessive talking, racing thoughts, psychosis, multitasking, lack of focus. Symptoms of hypomania are similar to those of mania, except they last for a shorter period of days and aren't severe. Depressive episodes may be characterized by low energy, lack of interest in daily activities, hopelessness, little or no appetite, feelings of guilt, suicidal thoughts, sadness or low mood. An individual experiencing hypomanic episodes may experience similar symptoms to those of the manic episodes. People who experienced hypomania associated with bipolar 2 enjoy the increased energy and decreased sleep. Episodes of hypomania don't escalate to a point that a person needs hospitalization, which sometimes happens to a person experiencing mania, especially if they are becoming a danger to others. Hypomania symptoms are similar to those of mania, but they are less severe. Nonetheless, others notice these symptoms. Unspecified bipolar and other related disorders. This is commonly ascribed when a mood disorder is characterized by depression alternating with short episodes of hypomania. Oftentimes the mood swings are rapid, occurring within days of each other. It is most commonly diagnosed in children and adolescents, as they are less likely to have a previous history of mood dysfunction. Bipolar 1 disorder. To be diagnosed with bipolar 1 disorder, you must have manic episodes that last at least 7 days or manic symptoms that a person needs immediate hospital care. While bipolar 2 disorder. This involves depressive episodes and hypomanic episodes. The major depressive episodes last at least 2 weeks, but not a full-blown manic episode that are typical of bipolar 1 disorder. Bipolar 2 is sometimes misdiagnosed as depression, as depressive symptoms may be the major symptom at the time the person seeks medical attention. When there are no manic episodes to suggest bipolar disorder, the depressive symptoms become the focus. Diagnosis. Bipolar disorder is diagnosed by a well-trained psychiatrist or a mental health professional who then asks you questions about your health background, including that of your family. It is sometimes very important to bring a close friend or partner with you, as they may be able to answer questions you might not be able to answer. Be sure to watch out for my next video about the types of PTSD. Please like, subscribe and hit that notification bell to be the first to know in case I upload. Thank you.